My name is Jenna Byrd, and my topic is epididymitis. So, epididymitis is the inflammation of the epididymis, which is a coiled tube at the back of the testicles. It stores and carries sperm. Males of any age, they can get epididymitis, although it's more predominant in younger men who are sexually active or older men with like a bladder outlet obstruction, such as BPH or any prostate enlargement. Epididymitis can be caused by bacterial, which is most commonly what causes epididymitis. There are also fungal infections, parasitic, viral, autoimmune, chemical, idiopathic, or they can be trauma related as well. If there's any involvement in the testes, it's actually termed epididymoorchitis. Um, so some risk factors, one of the biggest risk factors for epididymitis is any exposure to an STI. So many STIs, especially like gonorrhea and chlamydia, they are the most commonly STIs to produce or to cause epididymitis. Other risk factors are like prostate enlargement, uncircumcised penis because that can entrap bacteria and cause urinary tract infections, and then any urinary catheters or any kind of invasive procedures where they're introducing maybe some bacteria, external bacteria into the tract. And then any males who practice sort of anal intercourse, that also could produce an enteric pathogen into the urinary tract. So general prevention is definitely safe sex practices. Make sure you get your mumps vaccination because that can cause it. Any kind of prophylactic antibiotics before urethral manipulation, early treatment for BPH, vasectomy, and make sure you enter bladder prior to physical exertion. So there's three key questions to ask when you're trying to determine if this is epididymitis. First is, are you sexually active? So this just provides intel on certain risk factors for epididymitis, and then what could be causing it if you're leaning more towards an STI or if you're leaning more urinary tract infection related, or one of the other ones that could possibly be causing it. So the second question I would ask is, was the pain sudden or was it gradual? So epididymitis, usually the onset of pain is going to be a gradual pain, whereas testicular torsion is very sudden. So you always, any kind of disease or process that's going on with the testes, you want to make sure that you rule out testicular torsion. So this is a very big question that you need to ask to differential testicular torsion out of the equation. So if you want to ask too if you're experiencing any urethral discharge or UTI symptoms, just because the treatment for UTI and STI, they're a little different, so you want to kind of get down to the bottom of really what you think is causing it. So top 3 physical exam findings, you want to examine and palpate the testicles and the epididymis. So the epididymis is going to be really tender, especially the posterior epididymis. You also want to try to elevate it and see if this causes it to reduce discomfort. That can be a sign as well. And then you always want to check for cremaster reflex, because in any case where the cremaster reflex is absent, testicular torsion should be suspected, and then a Doppler ultrasound is the test of choice for that. So you always want to check that to rule that out. Treatments basically is based on age and just the causative agent suspicion. So sexually active males under 35, where you're thinking, GC chlamydia, you want to give an IM dose of Rocephin 250 and doxycycline 10 milligrams 2 times a day for 10 days. In adults who practice the insert of anal intercourse, where you're thinking maybe this could be GC chlamydia or enteric pathogen, you want to do an IM dose of Rocephin 250 and Levaquin 500 daily for 10 days. So males that are greater than 35 years old who have had any kind of procedure or a recent UTI, you want to do Levaquin 500 milligrams daily for 10 days. So usually the infection will clear and the symptoms resolve after the full course of antibiotics, but 3 key components to teach is you want to stress the completion of antibiotic course, even when they get better and they're asymptomatic. You want to encourage safe sex practices and just educate on other risk factors, because that's how they're going to be able to prevent epididymitis from happening. And then you need to encourage them to get their partner treated as well if you're thinking STI. And then usually the pain will improve 1 to 3 days, but it could take several weeks. So NSAIDs, ice packs, and then elevation will also help improve the pain.